Okay, so I was a dentist for 30 years, but I started suffering from dizzy spells, and I was forced to give up clinical dentistry. And I spent 8 years on the sideline and then decided to re-enter the dental arena, but it was impractical to be a clinical dentist again. So I'm now a dental service technician, servicing autoclaves and dental chairs. And over the past 2 years, I've become besotted with biofilm. Now, Dr. Laurie Walsh appears to be the expert on dental unit waterlines in Australia. His presentations cover the science and the chemistry and the health aspects of dental unit waterlines. And I was able to access some of his presentations on this website, and I really commend them to you. Now, my presentation is vastly different. You'll find no science in my presentation, just my observations at a practical level. And I know you'll have questions on what harm can biofilm cause, etc. But I can only talk with authority about the practical world of biofilm. That's where I work. And I need to refer you to Dr. Walsh for any scientific knowledge. So let's try to understand this problem. In every dental chair, there's a tap down here at the foot of the chair. And the water that comes out of this tap is normal drinking water. It's the same as the water that comes out of your kitchen taps at home. And it's the council's job to keep all of this water healthy. And water is considered healthy and drinkable if its measurement reads less than 500 CFU. So that when we turn the tap on, the water runs through our chair and out through our handpieces and triplexes into the patient's mouth. So we would expect that this exit water up here would read 500 CFU, the same as our town water. But if I squirt the water out of these instruments into a cup and test it, we usually find that this exit water is heavily contaminated. In fact, I see it testing anywhere between 1,000 and 10,000, and that is absolutely undrinkable. Now, when we're testing for contamination, we use this testing device, a single-use dipstick. And this is a test I did at a surgery. And firstly, I tested their mains water. And there's 4 dots on this, and that indicates about 400 bacteria per mil. So that's normal, healthy tap water. And this is a test I did on their dental chair, where I collected water from the handpieces and triplexes. And this reading is above 3,000. So it's hard to believe, isn't it? We put healthy water into one end of our chair, and out of the other end, we squirt heavily contaminated water into our patients' mouths. So this is when most surgeons will say to me, Kerry, we have a water bottle on our chair and we add a chemical to it, so our water sprays here will be quite okay. Now, the purpose of the chemical is to disinfect the water in our water bottle. We want to take it from the normal tap water of 500 CFU down to an extra healthy 200 CFU. And then we hope that the chemical can keep this water healthy as it travels through our dental chair and out into the patient's mouth. So we expect the water to be exiting here to be, oh, that's the chemicals we have. We expect it to be coming out at 200 CFU. So we test the water spray from plenty of chairs that use these chemicals in their water bottle. And guess what reading a lot of these chairs are? It's between 1,000 and 10,000. Now, here is a test from a local chair that used a disinfectant straw in their water bottle. And here is a test from another local chair that used disinfectant tablets religiously every day. And it's very frustrating for dentists that when they see this sort of result. The time and cost involved in dosing the chairs is just not producing results. And it's not that these chemicals are ineffective. They work well and they're a critical part of the protocols that I'm going to explain to you later. The problem is that our dental chair here is a cesspit. It's a breeding ground for bacterial contamination. And it's because of all these long plastic hoses that they transport water inside our dental chair, and they are the breeding ground of our great enemy, the biofilm. Now, look, you can call it biofilm, you can call it plaque, but the most descriptive term is slime. It looks and feels like a decomposing jellyfish. So the situation we have normal tap water, and it's about 500 CFU. We put that tap water into a bottle. a water bottle for your chair, and you put some sort of chemical in that water bottle to make that water even better, to get it below 200 CFU. Then the water travels through our dental unit water line until it gets to the triplex and our handpieces, and then we squirt the water into our patients' mouths. And the water, so the problem is that our dental unit water line is not nice and smooth. It's got all this biofilm lining the inside of it, and it's like little tufts of cotton, little fluff. And as the water flows over this, it knocks the little tufts of fluff off, and it starts floating within the water line itself. Here's another image, and the way the biofilm, little bits fluff off, tiny little emboli start floating within the water. So those emboli, little bits of fluff, come along the water line, they come out of the triplex, and that's the quality of the water that ends up coming out. So the water that we're putting into the dental unit water line, it's exactly the same as the water coming out. It's just that it's got all of these blobs of biofilm in it. So every little red dot here indicates a little piece of biofilm that's landed on the testing dip slide. Now, yes, obviously now the only way that we can produce healthy water is if we remove this biofilm from our dental unit. Wherever the biofilm is there, little bits will be coming into our water lines, and we'll always have contaminated water. So what does biofilm look like? Let me take you to my workplace. So any body of water that sits stagnant for a while will develop slime. For example, when you're cleaning out your dog's water bowl, if it's slippery, that's biofilm. There might be a bit of slobber with it, but it's mainly biofilm. And when I turn up every year to service an autoclave, I'll open the lid to the water tank, and as I rub my finger along the plastic, I can feel it's slippery. Again, this is biofilm. And because the water is heated and stagnant overnight in your autoclave, it's absolutely normal that biofilm will form. Now, I clean this biofilm out when I service the autoclave, but after a few months, the slime will just naturally return. It's just biology at work. Now, you can see this autoclave, it has no doors on top here. So we can't access the clean water tank to clean it. In fact, this autoclave, the water tank inside is completely sealed, so that when we service it, we cannot clean the biofilm out of the tank. Now, I needed to drain the clean water out of this tank so I could pick it up and take it to the workshop. And this is what the water looked like that came out of the tank. It's full of floaties. And this is the biofilm that is so fragile that it flakes off the side of the tank and floats in the middle of otherwise healthy water. Now, any body of water will look like this if the biofilm is left untouched for long enough, and your dental unit water line is no exception. A little bit different. One day I was servicing a dental chair, and I noticed that the nurse's triplex was not working properly. It was squirting air, but no water. I removed the triplex body here to reveal these two nipples that feed air and water into the triplex. The water nipple was blocked with clotted biofilm, which is one of the problems with biofilm. It can clot into a ball, which can occlude your water line completely. But I removed the clot from out of the water line, out of this nipple, and water started flowing out of it the way it should. And I collected the water in a cup, and this is what it looked like. Now, this is 100% unadulterated biofilm. The top cup is from the first seconds of flow. The lower cup is it's a little while later. Now, this surgery used disinfectant tablets religiously. So this water entered the dental chair pure and clear at 200 CFU. It stayed stagnant for a few months in the triplex line because the water couldn't escape through here, and this is what it turned into. It'd be embarrassing that happened in the chair. Now, if a biotest of your water shows that you have biofilm in your lines, we'll remove it using a product called BRS Remover, and it dissolves the biofilm into a liquid that can be easily squirted out of the water line. So number one here is the fresh BRS liquid before we put it into your dental chair. You can see it's a nice pink colour. We run it into your water lines and leave it for 20 minutes in your chair, and the BRS liquefies the biofilm and when we squirt it out through our instrument hoses, I like to collect it in a cup to see what it looks like. So this is from your assistance triplex, and this is from your dentist triplex. What's it? This is from your high speed, is it? And your slow speed and the scaler. And you can see that the liquid has changed colour in all of these down here. So it indicates that there is biofilm in each one of these lines a little bit. But it's the assistance triplex that's really chock-a-block with biofilm. And it's a very frequent situation, as in some surgeries, the assistance triplex is rarely used. So it's stagnant for extended periods of time. I now think back to when I was a dentist, I dropped my triplex quite a bit. So I would immediately just reach over and grab the assistance triplex. So the amount of biofilm that I must have been squirting into my patients' mouths, it totally embarrasses me now. So it's really important to care for every single one of your water lines, even if they are rarely used. Like maybe your slow speed handpiece. Most people don't have water on their slow speed handpiece, but there will come a day when you'll think, oh, well, gee, I've got to use a little bit of water with this. And if you try to use it and you haven't been looking after your water line, it'll be just full of biofilm. You're just going to squirt that straight into the patient's mouth. So you've got to make sure that every single one of your water lines is maintained in primary health, because there is just one day that you want it, and you want it to be healthy when you use it. Here is another dental chair that I did. Here is the original liquid, and you can see that the scaler is the line with the worst biofilm there, but everyone has a little bit of biofilm compared to the unadulterated product. And this, it's a common photo these days, but this is what biofilm looks like at its worst. So this can build up within your hose, can make a bulk movement and actually squirt out of your water line into the back of your hand pieces or into your scaler. It's pretty gross if this was to happen. I've never seen it, but it's possible, obviously, and that's what it would look like. Now, this is not dental unit biofilm, but it is water biofilm that's developed in a pond. I reckon the concept must be fairly similar. The film sticks very well to the solid surface, but these outgrowths out here, they're very fragile. They can break off easily and be swept away in the water flow. So this is how I imagine biofilm looks like at a microscopic level in our dental unit water lines. Now, plaque is also a biofilm. You go to the dentist and he does a really good clean for you. But how long before your teeth start feeling furry again? It's only a few days. Now, the biofilm growth in your dental unit water line happens exactly the same. Now, you need to get a toothbrush onto your teeth. This bloke certainly needs it. You need it every day to keep the furry feeling away. You cannot get a brush onto your water lines, so you need to use chemicals every single day to get rid of that furry feeling. Okay, so if I want to squirt healthy water into the mouths of a patient, how do we produce this healthy water? Now, I'm going to create a checklist of things that we must do down the side here. And the first step, as we know, as I just explained, is that we must remove the biofilm. But I place this job down in the corner, separated from the rest, because it's not part of our continuous care routine that's going to be up here. We do this once, the biofilm removal, at the beginning of the process, but the plan is, with good management up here, biofilm removal will be rarely needed in the future. But look, once we have removed the biofilm, once we've removed this biofilm, how do we prevent the biofilm from reforming and creating the same problem all over again? Because we know it's just nature at work. Now, if we look at this stream, the water up the top here is flowing fast. So slime will not form in this water. But down the bottom here, where it widens out into a stagnant pool, that's where you'll see the slime forming. And it's exactly the same with dental unit water lines. Biofilm does not form during the day when you're using a chair, because the water is constantly flowing through the line. But when the chair is not being used, like over a weekend, the water is stagnant, so the biofilm will form. So we need a preventive product in our water lines during those stagnant times, mainly on weekends. So we've removed our with our products, we've removed our biofilm and we're using a preventive during stagnant times to stop it from returning so we can get rid of the biofilm. Therefore, whatever quality of water we put in at this end, the same quality will be coming out into the patient's mouth. If we put tap water in at this end, tap water will come out the other end. The testing will be the same. Now, if we put medicated water in this end, the same medicated water will come out the other end. Things like ozone or electrochemical processes are available to medicate the water down here, but I know of no dentists that are using complex systems like that to medicate their water. Mostly, dentists add disinfectant chemicals to their water bottles, which means 200 CFU water is entering the chair and 200 CFU water will be squirted out into your patient's mouth. So let's add that to our list. We need a water disinfection product as well as our preventive product. And now a really important concept here is that we dose our water with disinfectant all of the time. Therefore, every drop of water that goes into a patient's mouth will have a little disinfectant in it. But the preventive is in the chair while the chair is not being used. And it is thoroughly rinsed out of the chair before you treat a patient. So at no stage will any preventive product be squirted into a patient's mouth. Now, back to our stream. What happens if we open the floodgates up here? All of a sudden, the water will flood down here. It will hit our stagnant area. It picks up any loosely connected slime and it'll wash it all away. So just relating that to our dental unit water line, our chair is turned off and the water is stagnant every single night. So some biofilm will form during the night in our dental unit water line. But one would imagine that that's quite soft and fragile after only 12 hours of formation. So when we work on our first patient the next day, it is like opening the floodgates inside our dental chair, running through the water line. That flooding water will pick up any overnight biofilm and squirt it into the mouth of our first lucky patient. So we must flush water through every one of our water lines every morning instead of squirting it into the mouth of our first patient. Now, there's a lot of people who aren't aware of this, but this is a worldwide protocol. And you are required with your waterline flushing protocol to perform a 20-second flush between patients during the day, but I don't think that's flushes related to biofilm. You still need to do it, but it's not a biofilm thing, so I don't worry about that one too much. The important one for me is the long 2-minute flush every morning before you see your first patient, trying to wash the overnight biofilm out of the chair before you squirt it into your patient's mouth. Now, this is not just an American thing. This daily flushing has become a standard procedure all over the world. And there are 2 ways to perform these flushes. Now, some modern chairs have a system where you plug each instrument hose into a port. There are 3 different brands. And with these sorts of systems, you simply press a button on your chair console and water is flushed through all of these instruments at the same time. But if you don't have one of these automated chairs, you need to manually flush each instrument hose one at a time. Now, to do this, you pick up each hose individually, you remove the instrument off the end, you hold the hose over the spittoon, you depress the foot control, and you run water for 2 minutes from each hose at the start of the day. So we're starting with our slow speed motor to start with, then we're going to do it with our high speed and our scaler, and then 2 minutes with the triplexes. So, you know, it's a fairly slow start to the day, but it's a worldwide protocol. Everybody's supposed to do it. So there it is. Here are your 3 steps to healthy water production. Now, and that's actually all there is. You will notice that I've not used the words shock treatment at all. And it seems to be an American term used for American products. And it seems to be used when they don't have a preventive product in their arsenal. And 90% of chairs in Australia, in the Australian market, are not American. Most chairs use the words biofilm removal and preventive for their products. They never mention the word shock, so I tend to avoid this word as well. Now, if you can do these 3 steps properly and consistently day after day, you will produce excellent, healthy water. But how do we know that water is healthy? Well, you need to water test it. That's the only way to know how healthy your water is. And you've got to do it regularly, and you've got to make sure the reading is under 200 CFU. Now, before I go on to the final section of this presentation, I want to have a quick look at our guidelines. Apparently, there's a new version not far off, but here are our current ADA guidelines where it talks about water lines, and here are the ADA practical guidelines on water lines. So there's quite a bit of information here for you to digest. Have a look through it, and you'll find where it talks about your water disinfection and your flushing routine and your water tests. Now, dentists were not taught this content at university, so many do not believe that it's an issue. But remember, whatever is in the ADA guidelines automatically becomes a part of the Dental Board guidelines. And if you do not conform to the Dental Board guidelines, your registration as a dentist or as a dental practitioner may be in jeopardy. Now, waterline quality is a worldwide issue. Europe has had dental waterline guidelines for many years, as has the USA. Unfortunately, private dental practice in Australia is lagging in its practical application of worldwide best practices in relation to water quality. And here's something you might like to know. If you're undergoing an infection control inspection in New South Wales by the Dental Council, one question on their list is, do you have protocols for dental unit waterline management? So you better have a good answer when they ask you that question. Okay, so on to number 4. This is where it gets, well, up to now, the whole story tends to make sense. The background's easy enough to understand. We know there's biofilm in your lines when it tests that way. And we've put together a protocol to produce healthy water. But that is where the easy stuff finishes. Now we need to apply all of this knowledge here to your particular chair. And if there's 2,000 people watching me now, there are probably 100 different chairs being used, some from Europe, some from the USA, some from Japan, some from China and elsewhere. And the instructions for these chairs will adhere to the dental unit waterline guidelines of their own country, and guidelines vary. Also, a lot of chair manufacturing companies make money from their own branded waterline treatment chemicals, so they are very unlikely to accept the use of other branded chemicals in their chairs. Your warranty may be voided if you use unauthorised chemicals in your chair. And the chairs might be imported into Australia, but the chemicals specified for these chairs may not pass TGA, so you won't be able to buy those particular products in Australia. So what can you do then? So the dental unit waterline chemical protocols are wrapped in a shroud of big business and politics. Let's see if I can tell you anything now. So if you're new to the world of biofilm, the very first step tomorrow is to test your exit water, and it will most likely show contamination. If the water going into your chair only has 3 dots and it comes out of your instruments looking like this, the water must be picking up contamination from inside your chair, and it means you have biofilm in your lines. So you must remove this biofilm. And I'm generally trying to avoid using brand names in this presentation, but as far as I know, there is only one product that can remove biofilm in dental unit waterlines. So I'm comfortable naming this particular product, and it's called BRS Remover Set. Now, what we require from a biofilm removal system is that it must remove all of the biofilm, but during removal, that biofilm needs to be liquefied so that the resultant slurry can be squirted out easily through your water lines. There's a big problem if the remover works by removing the biofilm in clumps, because those clumps can actually combine together to form a plug, which might actually result in a blockage of your water line. I'm in communication with a gentleman who owns Hayes Handpieces. His name's Adam Matthews. And half a dozen years ago, he found that most of his repairs on the handpieces was due to biofilm from the dental unit waterline that's found its way into the handpieces. Since then, he's been searching for a cure for this problem. He started using BRS 3 or 4 years ago, and he claims that from that very first day, BRS Remover has given complete biofilm removal with no clogging of waterlines. Now, and he's removed biofilm from many chairs and many different brands of chairs. So I use his experiences as my information base. Now, my own experience with BRS over the past 18 months is exactly the same. Biofilm removal with no clogging. But this is where the politics start to impact on us. BRS Remover is approved for use in a number of chair brands. Look on the BRS website, the BRS website, to see if your chair brand is on that list. Likewise, there are some chair brands that have not given approval, so be careful of your warranty on those chairs. If your chair does not have approval, you'll need to check with your chair manufacturer to see what answer they have for your biofilm. And as I said, there's no other product on the market listed for removal of biofilm in dental chairs, only BRS Remover. Now, having said that, there is a new biofilm removal product due for release. I ordered some a couple of weeks ago, but it still hasn't arrived. So I don't know whether it means it's not in Australia or they're just slow getting it out to me. But it is a third-party product. Yeah, put it there. It is a third-party product. And their website does not say it has approval from any chair manufacturers. So I'm not sure which chairs we are supposed to use this on. Also, there is a warning on their website that says waterline blockages to released biofilm may be experienced after treatment. So this sounds like one of those products that removes biofilm in chunks. These chunks coalesce to form a plug that can block your waterlines. And I really do want to be fair in assessing this, but I do not know how I can actually do that when I don't want to cause blockages in my clients' dental chairs. So I might have to leave somebody else to be testing that one out. I can't leave this biofilm removal topic without mentioning another product. It's household bleach. In Australia, I can only find one chair manufacturer that suggests using it, but that suggestion also comes with a warning. In terms of corrosion, the bleach process is not forgiving. So that's another product that I'm not prepared to test on my own clients. Now, here's a little test I did in my garage. It's not scientific. It's just really an observation. And up the top here, we have a water hose out of an autoclave that's been collecting biofilm for more than 10 years. I plugged up the bottom down here and poured agents into the top. And I left it as per the instructions for that particular agent. And number one here, I used 100% bleach. And this is the result. It's actually a pretty good thing at removing biofilm. But 100% bleach, you couldn't use in your dental chairs. So, do not do this to your dental chairs. It's dangerous, could break things. But I was very interested to see how good it was, and it's actually good. So I tried with another length of hose, the bleach at 10%, and I did it 4 times. So it did remove biofilm, but not as much as we would like. Next, I tested Dentacept S, number 2 here. And this is the result. Now, Dentacept S is not a biofilm removal agent. It's only a preventive, but as a biofilm removal agent, it actually worked pretty well. When I get some BioClear, whenever it arrives, I'll actually run this test again and do it all again. But I just don't have it for tonight, unfortunately. This next one, though, is BRS Remover. Now, with this BRS Remover, you're supposed to have it heated to 60 degrees. And I didn't have it heated to 6 degrees, so this is cold. And it's removed it great at both ends, but not in the middle. But this one I ran 3 times. So no, is it 3 times? The BRS Remover 3 times. And if you have a close look at that, there is no biofilm in that. That's a marvelous difference between that, and this product doesn't cause any damage to your dental equipment. The The thing is about this one here is that sometimes the biofilm is just so old and impermeable that it takes more than one session to remove it. It's not very often that BRS doesn't work the first time. I'd say 1 in 100, but it can happen. So here is an initial test I did on a chair, and we removed the biofilm from every chair in his surgery. And here are his surgeries 7 days post-removal. Surgery 2 still has biofilm in it. So we returned and removed the biofilm from surgery 2 again, and here we are a couple of days later. So as you can see, you do need to test a week after you remove the biofilm just to make sure it is all gone. Here's another surgery assessment test, and this is all of their 7 chairs. This is all of their chairs 7 days post-removal. And this is the result we expect 99% of the time. 1 dot here, 2 dots there, no dots there. That is very, very healthy water. Anything below 3 dots is good. At this surgery, the assessment paddle on the left shows that their water lines are contaminated. So we remove the biofilm, and the paddle on the right is from the 7-day test. Biofilm was all removed successfully. They now institute their water disinfecting product, their preventive product, and their daily flushing routine. And here is their bio test 4 weeks later. Here it is 9 months later. And we have an environmental laboratory just down the road from my place. So I had them test a water sample also. And here it is. It's a perfect result. So here's an example of a surgery where once the biofilm was removed, they have been diligent with their protocol. So they're continually producing healthy water now for their patients. And if they can keep this up, biofilm removal is unlikely to be needed in the future. Okay, now that we've removed our biofilm with our material, you've got squeaky clean water lines. Now let's see how we go applying our steps to different brands of chairs. And these are the brands of chairs I commonly come across. There are other brands. We could have put another layer on here, but there's not enough room or time to talk about them all. And there are plenty of third-party products. Oh, not plenty. There are third-party products on the market as well that can be bought and used. Now, the first thing to notice is that every chair brand demands a flushing routine, a water flushing routine. And I'm not making this up. If you grab your chair manual and flick through it, you'll find this requirement written in there. Also, as we know, it's an ADA guideline requirement anyway. Secondly, these chairs require testing. And this sort of information you'll find on their website or in the chair manual. Where are we? And this particular brand here, they want you to start testing monthly. And once your tests are continually good, you can extend it out to 3 monthly, but no further. This brand wants you to start testing 2 weekly and slowly extend that to around 3 months maybe. This brand, well, it's very unusual. They do not seem to have a recommendation on water testing. They do say, though, that their water hoses are so good that biofilm will not grow on them, providing you're using their particular protocol up here. And this brand says that you need to test as required. And I haven't looked up these other brands or any others, but undoubtedly they're going to require testing as well. Now, the ADA says you need to test, but they don't say how frequently. Now, I know, look, I've just developed my own feeling about testing, and it makes sense to me to test your chair at week 1 to make sure the biofilm is all removed, then at 4 weeks to make sure your protocol is working properly, and then 3 months testing every 3 months for the first 12 months. Then if all your tests are excellent, you could probably extend that to 6 monthly. But don't forget, it only takes one lazy nurse to open up the gates to biofilm in your chair. And if you're not testing regularly, you don't know that the problem is developing. Now, if I were in your surgery instructing your staff right now, I'd be talking in detail about one chair or two chairs that you have in your own practice. And I'd be specifying the products and what I think about them, etc. But because this is such a wide audience, I can only give a quick politically correct overview of these chairs. Now, with this first company here, if you look at their website, you will see that they produce their own water disinfecting product, but they do not recommend a preventive product. And they do not have an automatic rinsing system, but there is a button that you can push on the unit that will rinse all of the hand pieces together, which is pretty handy. Now, here are some test results. And these chairs were all using their water disinfection product, but without a preventive product, you just cannot control the biofilm. Now, this company, they have their own water disinfecting product, and they have their own preventive agent, and they use really a preventive system. It's called sanitisation. And a lot of these chairs have an automatic rinsing system as well. And here are some results. They're not mine, they're from my colleague Adam. And I'm pretty sure that these practices were using their water disinfection product up here, but I don't think they were using their preventive protocol properly. This company, they have their own disinfection product. They have their own preventive product and system called intensive germ reduction. And most of these chairs have an automatic rinsing system as well. Plus, they have those fantastic non-stick water lines, or they claim to. Now, let's have a look at their results. So they've all got contamination in them, but I know that these practices were not using any preventive measures at all. So no wonder they've got contamination despite their fantastic water lines. Now, this brand, it does not have a disinfection chemical, although it does offer an electrochemical alternative. Its two preventive products have not passed TGA, so we cannot buy them in Australia, but they do offer a third alternative that is available. And they do have an automatic rinsing system available. This product here, they have a water disinfection product that they produce and a preventive one as well, but they haven't passed TGA, they're not in Australia, and it's the same with this particular product. The third-party products over here are generally not accepted by these various chairs here because they're selling their own products, although there are a few exceptions. So don't get caught using these products on a new chair. You may well avoid your warranty. If you do choose to use any third-party products, they still require your daily flushing routine and they still require testing. And make sure that they have a disinfectant product and a preventive product. A disinfection product alone, it's useless, okay? The real key is to have a good preventive product. The straw systems here, they're only a disinfection product. They do not have a preventive. Here is one chair I saw that used a straw with no preventive, so the straw really wasn't having any impact. So please, please, please make sure you use a preventive in your protocol. Now, I'm very sorry if that made things more confusing, but it's just the simple truth. As I said, if we're going into detail on one chair only, it's all very simple. Spreading the story across multiple brands makes it look complex. Now, just to make things more confusing, the plumbing in your chair also controls how you use your products. There are three ways that water can be delivered in your chair. Firstly, water can come from your mains tap at the bottom of your chair, and this water is directed through to your handpieces. The second type of delivery is exactly the same, except in these units, there is a chamber in the unit here, and you pour your undiluted disinfection product into this chamber, and the chamber has direct access with a water line. And the unit dispenses the correct amount of disinfectant automatically into this water line. Then, at the click of a button, this chair will perform its preventive protocol all by itself. The third type of delivery is those chairs that are originally installed with a water bottle attached. You add the disinfection product into the bottle, usually diluted, and the fluid is drawn directly into your handpieces, etc. Then, for the stagnant periods, you manually add your preventive product into the water bottle. So here's our three types of plumbing: our mains, our bottle, and our chamber. And many brands offer all three options. But you usually need to request the bottle or the chamber system. Otherwise, they'll be plumbed directly to the mains as a default. The care of dental unit water lines has never been a big deal in Australia. It's been in the ADA guidelines for a long time, but it's never really reached our consciousness until the last year or two. So when dentists were ordering their chair from suppliers before 2020, they rarely ticked the box to have a water bottle or a chamber system, which means that many, many, many dental chairs in Australia are plumbed directly into the mains. Now, these chairs develop biofilm, but you cannot control the water quality because you cannot access it with chemicals. So if you've got a chair with this sort of plumbing, you must convert it to one of these other options. And usually the easiest option is to have a water bottle added. If you happen to have a chair with a chamber system, the plumbing is complicated. So you are totally restricted with what chemicals you can put in these. Only ever use the product recommended by the manufacturer in these chambers. Never put BRS solution in these chambers. You'll ruin your chair. To remove biofilm from these chairs that have got a chamber, you actually need to have a service technician do it for you. Now, something to be aware of. Dental chairs are made overseas. When they leave the factory overseas, they often have water left in them, and they travel to Australia on slow boats, and they sit in warehouses for a long time. So this water is often sitting in the unit for many, many months, and the first squirt of water after installation is often putrid because it's full of biofilm. And this is a dip slide from a newly installed chair. Now, I simply followed the manufacturer's instructions in caring for this water line, and this is the laboratory test a month later. So 2 lessons to learn from this. Expect your new chair to be installed with biofilm already in your water lines, and institute your waterline care immediately. Okay, so that's sort of where I normally stop, but I thought I might try and add something else in for this presentation, where we might look at the process and see what you can do for yourself and what things you may need help with. So you can do a water test all by yourself. You order a tester from your supply company, follow the instructions, and let it sit. Now, they do like to incubate at 35 degrees or so. So the air-conditioned office in winter is not the best place for incubation. Find a warm place, maybe your communications cupboard, or you might find some warm place around the surgery. Now, the test will work at room temperature over a week, but the colder it is, the longer it'll take. And if it's too cold, the test might fail. And when you are testing, you need to get a sample of water from every single water line that you use. So you need to have the water for each instrument turned up to its maximum. You need a sample from your cup fill, your assistance triplex, your high speed, your slow speed, your dentist triplex, your scaler. Don't leave any of them out. Now, there are some new dip slide testers that have just hit the Australian market. They're only about $70 for a box of 10, which is ridiculously cheap. And I thought getting some cheap testers might be great, so I bought them a fortnight ago. And I tested a chair that had never had any waterline treatments, so I knew it would be full of biofilm. And this cheap slide told me that there's no contamination. I then took a water sample to the laboratory, and here is the result. The waterline really is contaminated, so the cheap dip slide was telling me a lie. So then I went out to my wife's worm farm and tested the worm juice. And this is the result that the test gave. Now, apart from being very crappy around the edges, which makes me doubt its quality, the number of dots here suggest the worm juice is equivalent to a moderately contaminated dental chair. And this is the laboratory test of the worm juice, and it shows total contamination. So it looks to me like these dip slides might underestimate the level of contamination by a long way. Or it might even give 0 readings when, in fact, the water is definitely contaminated. So I know it's only in the early stages. I've only tested a few times, and I will definitely do more testing to be certain. But at this stage, I will avoid the $7 dip slides, and I'll be spending $30 on each of my dip slides because I know they work. Now, your water test will take 5 to 7 days to process in the surgery, and your test might look like this, which suggests there is no contamination in the water. And this would be quite a surprise, as nearly all untreated water lines have biofilm. So if you get a result like this, we don't trust it. You need to retest again. And if that test is the same, then you need to have the test tested in a laboratory. Only then will we trust this 0 contamination result, as long as it's a previously untreated chair. If your water test looks like this, you definitely have biofilm in your water lines, and that biofilm needs to be removed. So, can you do the biofilm removal yourself? Well, if your chair uses a tank system, no, you cannot do it yourself. You need a service technician to do it for you. If your chair has this sort of plumbing, you cannot clear the biofilm yourself. You need a technician, but it makes way more sense to add a water bottle to these chairs and turn it into one like this. And if you have a water bottle on your chair and your chair is approved for the use of BRS, yes, you can remove the biofilm yourself. Just buy the product and follow the instructions. But one of the components has a pH of 12 and another has a pH of 2. So I would not let the staff do it unsupervised. The boss really needs to take some responsibility for this one. However, really, biofilm removal is the cornerstone of the entire protocol. So watching an experienced person do the removal the first time would give you a better short-term result and the best long-term education for yourself. You could do it the time after. But look, if your chair is not approved for use of BRS, you need to contact your manufacturer and ask them how to deal with it. Another water test is needed 1 week after biofilm removal, and that's to prove that the biofilm removal actually worked. Again, you can do this water test. And BRS produces excellent results. And we expect it to look like this. So if your test shows no contamination, we accept this result this time. If your test shows contamination, you need to go back to biofilm removal again. Next, you need to prescribe the correct water disinfectant and preventive protocol, and you need to find out if your chair's got an automatic flushing routine. Now, there's a lot in this to get your head around, but if you can read a manual or talk to the manufacturer, you can do this yourself. But it's a lot easier if you've got somebody to help you with this. Next, you need to start a water testing regime, which of course you can do, but you need to follow the timetable you've set. I talked about my timetable earlier. And you need to understand your test result. If your test looks like this, count the dots way more than 2. Biofilm removal is needed. If you get a test like this, where there's 2 or 3 dots, that's fantastic. This is exactly what we expect to see. You are doing a good job caring for your water line, so keep up the good work. But what about if your test is like this, 4 or 5, maybe 6 or 7 dots? Now, this is most likely a breaking down of your protocols. So it's time to revisit your protocols and re-educate your staff. Finally, you need to educate the staff. You need to motivate the staff, and you've got to ensure that regular testing is carried out. Look, if a surgery is trying to complete this entire process themselves, it's hard enough getting through to this point here, but this is where most surgeries fall down, because if your staff don't understand the issue, they won't care about it, they won't bother testing, and the whole deck of cards will unravel. Now, I've set up a process of ringing my surgeries when water testing is due, and I look at their photos of their results, and I follow it up for a year or so. And I find the staff are way more engaged then. They feel like they're doing something worthwhile. They become far more meticulous and proud of their results. They actually get in front of the curve and are ready with a full report when I ring them. So if you have someone in your surgery that has the time to oversee the situation, of course, you can do it yourself. Okay, so healthy water is not optional. The public and the dental board, they don't care if you weren't taught this at university. They both simply expect that healthy water will be squirted into the mouths of anyone who visits the dentist.